Welcome back. This morning we're speaking with Dr. Ben Emery from Aspen Ridge Dental. Thanks so much for coming in.
Thank you for having me.
So today we're talking your words of wisdom on wisdom teeth.
That's right.
So tell us now, some of the first questions that come to my mind are, when do you know that you have a problem that you have to go in and see about your wisdom teeth?
Well, some people don't know that there's a problem there. Some people do because their teeth are starting to move forward and come up through the gums, and then they start to get sore. They feel like they're crowding the other teeth that are in the mouth, etc. And they start to get sore. Gum infections can happen also because they start to poke through the gums, and you can't keep that clean. And so what happens is a little bacteria from the mouth gets stuck underneath that tooth in the gums, and you get these chronic gum infections. Sometimes they develop pus, sometimes they don't, sometimes they bleed, and so oftentimes people will come in with situations like that and where they need to have them removed.
Okay, but not everyone has to have them removed. Do you have any idea of what percentage of people end up having to have them removed?
I don't know the exact numbers, but I would say the majority of people need to have them removed because there's not enough room in the mouth for the wisdom teeth to come in.
Seems so weird. Why do they even grow there?
I don't know.
Seems like we should have evolved past that by now. So what age do people generally have this problem and need to have their wisdom teeth taken out?
I'd say later teenage years is when we typically would like to have them removed. I think that's the most common time because at Aspen Ridge Dental we think that in those years, people heal better, and so the operation, the surgical process, the post-op complications are less, and so it's a lot easier for that person to heal.
All right, and you brought an image for us to take a look at as well.
I did.
Take a look at that. Show us what we're looking at here.
So here are the wisdom teeth on the bottom, on this side, this side. The other complication that we have is that you can see how this wisdom tooth is pushing up against the back.
Yeah, they're really growing in sideways.
Growing in sideways, exactly. So that can lead to two problems. One, creating periodontal problems or bone destruction on the back side of that tooth, on the molar that you want to keep. And so that compromises the support of that tooth. The other complication can happen is that this will erupt just enough to where you get decay or cavities on the back side of that tooth. And when you have decay on the back side of the tooth, we go in to try to do a filling. Very difficult to restore that area, especially because this is continuing to cause decay. So the best thing to do is to remove these so that you can better floss them, keep them clean with the toothbrush, etc. So you don't have decay, so you don't compromise the integrity of these last molars. So you don't lose them.
Good to know. Now I know when I had my wisdom teeth taken out, they knocked me out, put me under completely. Is that always necessary?
It's not always necessary. I think it's a good idea. We would recommend it just because it's a lot more comfortable for the patient to be sleeping during the procedure.
And of course, I found that my key, I didn't have too bad a time with it, but my key to success, they recommended that I keep that ice on there. The more you can keep that ice on there, the better off you're going to be for that swelling.
Exactly. Swelling, bruising, etc. Ice is good. Ibuprofen, anything that's a non-steroidal anti-inflammatory is a good idea also.
Excellent. Well, thanks so much for coming in. If you have any questions, you can contact Dr. Emery at Aspen Ridge Dental on the number there on your screen. Coming up next, meteorologist Joe Hansel will have another check of your